Hello everyone, I'm Dr. Madhu Goel and today we are going to talk about the complications of preeclampsia and how to treat preeclampsia. So in the last video, we discussed about what is preeclampsia, the cause of preeclampsia, high risk factors for preeclampsia and how to prevent it. So I hope you remember that preeclampsia is a disease in which you have high blood pressure and organ damage. While most of the preeclampsia is usually mild, some cases can be very severe. The complications of preeclampsia include, very importantly, eclampsia. So eclampsia is a condition in which the patient starts throwing fit. It can be a serious, a lethal complication in pregnancy, and we can lose both the mother and the baby. So once you have preeclampsia, we need to keep a watch out for any signs and symptoms of onset of eclampsia. That means if you are having severe headache, nausea, vomiting, blurring of vision, those are the signs when you should rush to the hospital. The other complication of preeclampsia are HELLP syndrome. HELLP syndrome is hemolysis, elevated liver enzymes and low platelets. It's another lethal complication of preeclampsia and one needs to terminate pregnancy as soon as possible. The other complications and more common complications of pregnancy are placental abruption. That means the placenta gets separated from its bed and you suddenly start bleeding. So again, there is a risk to both the mother and the baby and hence you should rush to the hospital immediately. Other complications include organ damage. That means there can be kidney damage, liver damage, damage to your eyes, damage to the lung, there can be fluid collection in the lung. Some of these complications can last beyond pregnancy as well. As in, we have seen that women who have preeclampsia during pregnancy are at a higher risk of cardiovascular disorders even after delivery. So they need to remain under care even after you have delivered. So these complications are not limited only to the mother. Some of the complications affect the baby. Small for growth babies. That means the babies are not growing properly, their birth weight is lesser than what we expect it to be. There is a higher chance of preterm deliveries. So because the only treatment available for severe cases of preeclampsia or any of the complications is delivery, even iatrogenically, we take the babies out before they are due. So preterm babies, as we all know, are more likely to go to the nursery, are more likely to require intensive care. So there are other complications like stillbirth. That means we lose the baby at the time of delivery or during delivery. There can be neonatal complications and babies may be need to kept in the nursery. So because, as you can make out, that the list is not very nice, preeclampsia is a disease which you need to be aware about and which needs to be monitored at each and every visit of pregnancy. So how do we treat preeclampsia? Let's say you've had preeclampsia. So mild cases will only require monitoring. That means you will be called to your doctor more frequently. There may be blood pressure charting which may be required on your end. Antihypertensive, that means the blood pressure medicines given to lower the blood pressure are used and more investigations are required. We follow your platelet count, we follow your liver enzymes, we follow the baby's growth on ultrasound so that at the first sign of complication we are able to monitor, okay, this pregnancy has taken a downward turn and we need to deliver you. So in severe forms of preeclampsia, you may require admission and remember, the only treatment available for preeclampsia is delivery. So whenever we think that the mother or the baby is at risk, we will take the baby out, we will do the delivery in order to ensure a good outcome for both the mother and the baby. In addition, anticonvulsants may be required. Remember, I told you that one of the complications of preeclampsia is eclampsia or the mother throws fits. So we give preventive magnesium sulfate to prevent these fits. These pregnancies are complicated and you should deliver at good obstetric centers with a good nursery backup facility. So hopefully this information will be helpful to you and will benefit you.